Namaste everyone. My name is Dr. Krishna Kololi, Associate Professor in Rognidan Department, Indian Institute of Ayurveda Research and Hospital, Rajkot. My topic name is a pharmacopathogenesis of a bronchial asthma, that is TAMAK SWAS, an unmet disease, a single case study. We all of you know that a bronchial asthma, a respiratory condition marked by attack of a spasm in the bronchi of the lungs, which causing difficulty in breathing. It is usually connected to allergic reaction or the form of hypersensitivity, which is caused by the hypersensitivity, along with that which is characterized by the breathlessness, that is dyspnea, cough and wheezing. So 65 years old patient visits to my clinic. The patient has the symptoms like coughing, wheezing, shortness of breathing, cold, chest tightness. Sometimes patient feels pain in the chest and there is a trouble in sleeping. In according to modern science also, TAMAK SWAS can be correlated to the bronchial asthma. That is, tam means andhakar, we can consider it is darkness, and shwas means difficulty in breathing, that is dyspnea. So according to modern science also, the same symptoms can be observed into the patient. The associated complaints observed in the patient, that is sometimes patient has atisar or malabaddhata on and off. No family history of any major illness found, including asthma. On examination, it was found that wheezing and bronchi sound present in a lower lobe of the lungs bilaterally. Air entry not equal on both sides. Blood pressure 140 to 90 mm of Hg. Pulse 56 per minute. Patient has bradycardia. The pallor is present in the patient. There is also edema present on ankle and patient is febrile. I advise the investigations, that is asthma control test. In that, C-reactive protein ESR, that is erythrocyte sedimentation rate, forced expiratory volume in a first second, and neutrophil lymphocyte count, it is found significantly normal. In case of the CBC also, the eosinophilic count is highly more, and along with that IgE is also more in case of the patient. Allergic test also done for the inhalant, food, some pollen grains and molds. So some of the allergy patient had. Even in X-ray findings, there is a pulmonary hyperinflation seen. Bronchial wall thickening also observed, and peribronchial coughing also observed in the patient. So because of allergen, patient has allergic to so many things. So according to that, the according to that, the pathogenesis can be observed in the patient is when any kind of allergen when enter into the body, when it enter into the bronchial. So in the bronchial mucosa contain IgE immunoglobulins. All the allergens are attached to the IgE, and IgE is responsible for the activation of the mast cell. Mast cell is responsible for the triggering of histamines, and when there is excessive histamines found in the body, the histamines are responsible for the irritating to the bronchial mucosa. While there is irritating to the bronchial mucosa is more formed in the bronchioles. Along with that, there is a leukotrienes also formed, and because of that which causes the bronchospasm. So due to the excessive glucosa in the lumen along with the bronchospasm, there are three symptoms can be observed into the patient, that is a cough, dyspnea and wheezing. Similarly, in case of the tamak SWAS also, the Sannikrishta Nidan, that is a Vata Kapha Prakopajanya Ahar Vihar, along with the Viprakushta Nidan, that is Shit Rutu, Varsha Rutu, Pratakal. So these are the all responsible for the Kapatikya, which is responsible for the Marga Avrata by Kapha. Due to that, there is a Vata Prakopa takes place, leads to Vayu Vimargamana, and which is responsible for the manifestation of a Tamaka Shwasa. So on the basis of that, the treatment is given to the patient, that is a Kapha Vilayana, Vatanulomana, Agni Deepana and Ampachana. So I advise to the patient, that is a Bharangadi Kashaya, 30 ml with equal quantity of lukewarm water in the morning 7 am and in the evening, that is 7 pm. Along with that, I advise Shwaskutar Rasa and Vasa Rishta. So in that 250 mg BD along with the Vasa Rishta Anupana 30 ml with equal quantity of water or lukewarm water can be advised to the patient. So in conclusion, bronchial asthma can be compared to the tamak shwasa. Ayurvedic drugs can be scientifically used and its mode of action can be established based on the modern pharmacology and pathology. Acute episode of a bronchial asthma required integrated approach of a management along with the oxygen supplementation. These are the some references. Thank you.